Did you know that 1 in 4 adults over the age of 65 experiences a fall every year? Even more surprising, medications are one of the leading hidden causes of these potentially life-threatening incidents. But this issue doesn't just affect seniors. People of all ages can experience balance problems, such as dizziness, lightheadedness, and coordination issues, as a result of their prescriptions. A wide range of common medications, including blood pressure drugs, painkillers, sleep aids, and antidepressants, can interfere with brain function, muscle control, and even the inner ear, the key organ responsible for maintaining balance. Alarmingly, research shows that up to 40% of fall-related hospital admissions are linked to medications that impair stability and coordination. In this video, we're uncovering 10 widely used medications that may be secretly undermining your ability to stay balanced. And most importantly, what you can do to protect yourself. Some of these drugs may already be sitting in your medicine cabinet. And make sure to watch until the end, because medication number 9 is shockingly common, and probably in your medicine cabinet right now. But before we dive in, I'd love to know, where are you tuning in from today? Leave a comment below with your city or country. I always enjoy seeing where everyone's watching from. It creates a sense of connection, no matter how far apart we may be. And don't forget to like this video and subscribe for more wellness tips like these. You really don't want to miss what's coming next. 1. Sleep aids. Many people turn to sleep medications, such as Ambien, Zolpidem, Lunesta, Isopiclone, or over-the-counter options like diphenhydramine, the active ingredient in Benadryl and many nighttime pain relievers, to get a good night's rest. While these drugs can help you fall asleep faster, they can also linger in your system well into the next day, leading to morning grogginess, mental cloudiness, and an unsteady gait. Why is this dangerous? Sleep aids suppress activity in the central nervous system to induce drowsiness. This slowed brain activity impairs coordination, reaction time, and balance, making falls much more likely, especially in older adults. Some users even describe a hangover effect or report feeling like they're sleepwalking. Even natural remedies like melatonin or valerian root can cause excessive drowsiness or delayed coordination in sensitive individuals. If you're noticing unsteadiness or dizziness after using sleep aids, it's essential to discuss safer alternatives with your doctor. To improve sleep without the risks, try practicing good sleep hygiene. Avoid screens before bed. Create a relaxing nighttime routine. Go to sleep and wake up at the same time daily. And if you do use sleep aids, be especially cautious when getting up at night. A fall in the dark can have serious consequences. 2. Blood pressure medications. Managing high blood pressure is vital to preventing heart attacks and strokes. Medications like beta blockers, e.g. metoprolol, diuretics, e.g. hydrochlorothiazide, and ACE inhibitors, e.g. lisinopril, are commonly prescribed to keep blood pressure under control. However, these same medications can also cause troubling side effects, especially when it comes to balance and mobility. Here's how. Beta blockers lower your heart rate and blood pressure, which can cause lightheadedness or fainting, particularly when standing up quickly, a condition known as orthostatic hypotension. Diuretics, often called water pills, reduce excess fluid in the body but may lead to dehydration and electrolyte imbalances, weakening your muscles and leaving you feeling fatigued. ACE inhibitors can occasionally trigger sudden drops in blood pressure, especially when you first rise in the morning, making falls more likely. To reduce these risks, stay hydrated throughout the day. Rise from bed slowly and deliberately. Regularly monitor your blood pressure. Never adjust or stop blood pressure medications without consulting your healthcare provider. If you're experiencing frequent dizziness, it may be time to revisit your treatment plan. 3. Antidepressants. Antidepressants are life-changing, and sometimes life-saving, for millions of people living with depression and anxiety. But they are not without potential side effects, especially when it comes to balance and cardiovascular health. Types of antidepressants that may affect your stability include SSRIs, selective serotonin reuptake inhibitors, such as fluoxetine, Prozac, and sertraline Zoloft. SNRIs, serotonin norepinephrine reuptake inhibitors, such as venlafaxine Effexor. Tricyclic antidepressants, such as amitriptyline. Here's what you need to know. SSRIs and SNRIs can alter serotonin levels in the brain and affect blood vessels, which in some individuals can lead to increased heart rate, elevated blood pressure, or arrhythmias, irregular heartbeats. Tricyclic antidepressants, in particular, are associated with orthostatic hypotension, a sudden drop in blood pressure upon standing, significantly increasing fall risk. Long-term use of some antidepressants has also been linked to a slightly elevated risk of stroke or cardiovascular disease, particularly in individuals with pre-existing heart conditions. However, this doesn't mean you should stop taking your medication. Mental health is just as critical as physical health, and for many, the benefits far outweigh the risks. If you have a personal or family history of cardiovascular disease, high blood pressure, or abnormal heart rhythms, talk to your doctor about potential alternatives or strategies to minimize risks. 4. Diabetes medications. Diabetes medications are vital for regulating blood sugar, but they can sometimes cause hypoglycemia, a condition where blood sugar drops too low. This can lead to symptoms such as dizziness, shakiness, weakness, confusion, and even fainting, all of which significantly increase the risk of falling. This is particularly true for insulin and certain sulfonylureas like glipizide, glyburide, and glympyride. These medications work by stimulating the pancreas to release more insulin, which helps lower blood sugar. But if not carefully balanced with food intake and activity, they can push sugar levels too low. In fact, studies show that up to 25% of emergency room visits for hypoglycemia involve people on diabetes medications. When blood sugar falls below normal, the brain struggles to function correctly. Vision becomes blurry, the body may tremble, and reflexes slow down, creating a dangerous situation where a simple misstep can result in a serious fall. Furthermore, some newer diabetes drugs, particularly SGLT2 inhibitors like Jardiance and Invokana, can cause dehydration and lower blood pressure, especially if combined with diuretics. This can result in orthostatic hypotension, dizziness when standing up, making it harder to keep your balance. To reduce your risk, it's essential to monitor your blood sugar levels regularly, recognize early warning signs of hypoglycemia, stay hydrated, and work with your doctor to ensure your medication and dosage are appropriate for your lifestyle and overall health. 5. Heart medications. Heart medications are life-saving for people with high blood pressure, arrhythmias, or heart disease, but they can sometimes have unintended effects on balance and stability. Drugs such as beta blockers, metoprolol, propranolol, and calcium channel blockers, amlodipine, diltiazem, lower blood pressure and slow the heart rate. While this helps protect the heart, it can also make you feel lightheaded or fatigued, especially when changing positions suddenly, like rising from bed or standing up after sitting. According to the Journal of the American Geriatric Society, older adults taking blood pressure medications have a 30% higher risk of serious falls, particularly if their treatment causes orthostatic hypotension, a sudden drop in blood pressure when moving to an upright position. Additionally, diuretics, water pills, like furosemide and hydrochlorothiazide flush excess fluids from the body. While they reduce swelling and blood pressure, they can also deplete key electrolytes like potassium and sodium. When these minerals are out of balance, you may experience muscle weakness, leg cramps, and poor coordination, greatly increasing your fall risk. To stay safe, stand up slowly from a lying or seated position. Drink enough fluids. Monitor your blood pressure regularly. If symptoms like dizziness persist, consult your doctor. A dosage adjustment or medication change may help you stay both healthy and steady on your feet. 6. Anti-anxiety medications. Anti-anxiety medications can be a lifeline for those dealing with anxiety, panic attacks, or insomnia. However, they also come with potential side effects that can directly affect your balance and safety. Benzodiazepines, including Xanax, alprazolam, Valium, diazepam, and Ativan lorazepam, work by enhancing the effects of GABA, a calming neurotransmitter in the brain. While they reduce anxiety and promote relaxation, they also slow brain function, which can lead to drowsiness, impaired coordination, muscle weakness, and delayed reflexes. These effects can be particularly dangerous for older adults. Research shows that seniors taking benzodiazepines are at least 50% more likely to experience falls and fractures than those not using them. But this isn't limited to age. Anyone taking high doses or using these medications long-term may notice balance issues. Other anti-anxiety drugs, such as buspirone, can also cause dizziness or lightheadedness, especially when standing up quickly. The risk of balance problems is even greater when these drugs are combined with other sedatives like alcohol, sleep aids, or painkillers. To stay safe, use the lowest effective dose. Avoid combining with other sedating medications. Talk to your healthcare provider about safer, non-sedating alternatives or cognitive therapies. 7. Antihistamines. Antihistamines are widely used to relieve allergy symptoms, cold discomfort, and even motion sickness. But what many don't realize is that some antihistamines can significantly affect your balance and coordination. Older, first-generation antihistamines, like diphenhydramine, found in Benadryl, chlorpheniramine, and hydroxyzine, block histamine but also cross into the brain, affecting the central nervous system. This often results in sedation, dizziness, slower reflexes, and confusion. A study in the Journal of the American Medical Association found that older adults using first-generation antihistamines had a 20% to 30% higher risk of falls, mainly due to their sedative and disorienting effects. These medications can also impair vision and reduce spatial awareness, making it easier to trip or lose balance. While second-generation antihistamines, such as loratadine, Claritin, and cetirizine Zyrtec, are labeled as non-drowsy, they can still cause dizziness in some individuals, especially when taken with other medications that affect alertness. To reduce your risk, avoid first-generation antihistamines whenever possible. Opt for newer, non-sedating options. If you must take these medications, consider taking them at bedtime and avoid combining them with alcohol, sleep aids, or anxiety medications. 8. Pain medications. Pain medications, both prescription and over-the-counter, can have a profound impact on your body's ability to maintain balance, especially in older adults or those taking multiple medications. Opioids, such as hydrocodone, oxycodone, and morphine, work by binding to receptors in the brain and spinal cord to block pain signals. While effective for pain relief, these medications also suppress the central nervous system, CNS, which controls vital functions like alertness, coordination, and balance. This can result in drowsiness, slowed reflexes, confusion, and poor motor control, a dangerous combination that makes falls much more likely. In fact, a study published in the Journal of the American Geriatric Society found that older adults taking opioids have a 68% higher risk of falls and fractures compared to non-users. Opioids can also lower blood pressure and impair the body's ability to stabilize quickly when changing positions, causing orthostatic hypotension, which triggers dizziness upon standing. Even non-opioid pain relievers, such as nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, Advil, and naproxen Aleve, are not entirely risk-free. While they don't sedate the brain like opioids, NSAIDs can irritate the stomach lining, especially in sensitive individuals, and may also cause drops in blood pressure. At high doses or with prolonged use, NSAIDs may impair kidney function, which in turn can cause electrolyte imbalances or dehydration, both of which contribute to lightheadedness and instability. To reduce the risk of falls while using pain medications, always use the lowest effective dose for the shortest possible time. Stay hydrated to maintain blood pressure and fluid balance. Avoid combining opioids with alcohol, sedatives, or sleep aids. Consult your doctor if you experience any signs of dizziness or disorientation while taking these drugs, as a dosage adjustment or alternative treatment may be necessary. 9. Antibiotics. Antibiotics are crucial tools in fighting bacterial infections, but certain types can negatively impact the body's vestibular system, the part of the inner ear responsible for maintaining balance. Some classes of antibiotics, particularly aminoglycosides, such as gentamicin, tobramycin, and streptomycin, are known to be ototoxic, meaning they can damage the structures within the inner ear, including the vestibular nerve. This nerve sends signals to the brain to help you orient your body and maintain equilibrium. When damaged, it can result in a condition called vestibulopathy, which causes persistent dizziness, unsteadiness, vertigo, and in some cases, permanent balance problems. Research suggests that up to 20% of patients treated with aminoglycosides may experience some level of vestibular toxicity. This risk increases with higher doses, longer treatment durations, or pre-existing ear or kidney issues. Another group of antibiotics to watch for includes the fluoroquinolones, such as ciprofloxacin, Cipro, and levofloxacin, Levaquin. These have been associated with neurological side effects including dizziness, nerve damage, peripheral neuropathy, and even temporary drops in blood pressure, which can make sudden movements, like standing up quickly, feel disorienting or lead to falls. If you begin to notice balance problems, vertigo, ringing in the ears, tinnitus, or dizziness while taking antibiotics, contact your doctor immediately. They may reduce the dosage or switch you to a safer alternative. Avoid driving or activities that require coordination until your symptoms improve. Stay well hydrated and avoid alcohol or other medications that depress the central nervous system, which could worsen symptoms. 10. Parkinson's medications. Medications used to manage Parkinson's disease are essential for controlling symptoms, but many of them can unintentionally impair balance and significantly increase the risk of falls. Parkinson's disease itself is a progressive neurological disorder that disrupts the brain's control over movement, coordination, and muscle function. This alone makes individuals more vulnerable to instability. However, the medications commonly prescribed to manage Parkinson's symptoms, particularly those that influence dopamine levels, can worsen balance-related side effects. The most commonly prescribed treatment is levodopa, often combined with carbidopa in a medication called Sinemet. Levodopa works by replenishing dopamine, a neurotransmitter that is severely reduced in people with Parkinson's, thereby improving muscle control and reducing tremors and stiffness. Yet, one significant side effect is orthostatic hypotension, a sudden drop in blood pressure upon standing. This can cause dizziness, faintness, or lightheadedness, particularly when rising too quickly from a sitting or lying position. Research shows that up to 50% of Parkinson's patients may experience this type of blood pressure instability. Another group of Parkinson's medications known as dopamine agonists, including pramipexole, Mirapex, and ropinirole Requip, mimic dopamine in the brain and help reduce motor symptoms. However, they can cause daytime drowsiness, dizziness, confusion, and in some cases, sudden sleep episodes, which pose serious risks during activities like walking, cooking, or driving. Additionally, anticholinergic medications such as benztropine, Cogentin, are sometimes prescribed to control tremors, especially in younger Parkinson's patients. Unfortunately, these drugs can impair cognitive function, leading to confusion, blurry vision, and unsteadiness, which further increases the risk of falls. If you or a loved one with Parkinson's disease is experiencing frequent dizziness, imbalance, or falls, it's critical to consult a healthcare provider. Adjusting the dosage, switching medications, or changing the timing of doses can often help alleviate these side effects without sacrificing symptom control. If you're taking medications that affect balance, whether for Parkinson's or another condition, here are some proactive steps to help maintain stability. Speak with your doctor or pharmacist. Ask whether any of your medications may be contributing to balance issues. In many cases, a lower dose or a safer alternative can be prescribed. Stay well hydrated. Dehydration can worsen symptoms of dizziness, especially when combined with blood pressure medications or diuretics. Stand up slowly. When transitioning from sitting or lying down, rise gradually to give your blood pressure time to adjust. Create a safe home environment. Remove tripping hazards like loose rugs or clutter. Install handrails in bathrooms and along stairways for extra support. Strengthen your balance. Engage in regular low-impact exercises such as Tai Chi, yoga, or balance training to improve coordination and body awareness. Wear supportive footwear. Avoid slippery soles or backless shoes. Use non-slip shoes that provide good ankle support. Use assistive devices if needed. A cane, walker, or other mobility aids can add an extra layer of safety, especially in unfamiliar or uneven environments. Review medications regularly. Periodic check-ins with your healthcare team can help catch and correct issues early. Report any new symptoms like dizziness, unsteadiness, or fatigue promptly. If you found this video helpful, please like, subscribe, and share it with someone who may benefit from this important information. Staying informed is the first step to staying safe, steady, and independent. Take care, and we'll see you in the next video.